Hey everyone, welcome back to the channel. If you're watching this, there's a good chance you've looked down at your feet recently and thought, wait, are those actually my ankles? You are not alone. Swelling during pregnancy is one of the most common things I hear about from moms-to-be. And today, we are doing a full, deep dive into everything you need to know. We're talking about what's normal, what's not, which warning signs mean you should call your doctor right now, and practical tips to get relief at home. You're 20 weeks along, or 38 weeks, and counting down the days. This video is for you. Make sure you stick around until the end, because I'm going to share a symptom checklist you can actually screenshot and keep on your phone. Let's get into it. Section 1. Why does swelling happen in pregnancy? First things first. Let's understand why this happens, because once you understand the why, everything else makes a lot more sense. During pregnancy, your body produces about 50% more blood and body fluids than usual. That's not a typo. 50% more. Your body does this to nourish your growing baby and prepare for childbirth. All that extra fluid has to go somewhere, and a lot of it pools in your tissues, especially in the lower half of your body, because of good old gravity. There's also something called your uterus pressing on the inferior vena cava. That's the large vein on the right side of your body that carries blood back to your heart. When your growing baby puts pressure on this vein, blood return from your legs slows down and fluid builds up. This is completely normal. It's your body doing exactly what it's supposed to do. The medical term for this fluid buildup is edema, and it affects up to 80% of pregnant women to some degree. Now, here's the key thing I want you to hold on to throughout this video. Normal pregnancy swelling is annoying. Dangerous pregnancy swelling has specific warning signs. We are going to cover both in detail. Section 2. Normal versus abnormal swelling. The basics. Okay, let's talk about what normal swelling looks like, because I want you to know what you're looking for before we get into the scary stuff. Normal pregnancy swelling. It typically shows up in antricky, feet and ankles, hands and fingers. You may notice your rings getting tight. Face, mild puffiness, especially in the morning. It tends to get worse at the end of the day, get worse in heat or humidity, get better after resting or elevating your feet, get worse after you've been standing or walking for long periods. Start in the second trimester and increase as you get further along. B-roll, pregnant woman putting feet up on a pillow, sighing with relief. If your swelling fits this description, eases with rest, worsens with heat and activity, located in the feet and ankles, you are most likely experiencing completely normal pregnancy edema. What makes swelling abnormal? Now here's where we shift gears. There are certain patterns of swelling that are not normal, and these are the ones we need to take seriously. Red flags include, swelling that comes on suddenly, swelling in your face that doesn't go away, swelling around your eyes, puffy eyelids, one leg being significantly more swollen than the other, swelling accompanied by pain, especially in the calf, swelling that doesn't improve with rest and elevation, swelling that appears before 20 weeks. We're going to go through each of these in much more detail in just a moment. But first, let me tell you about the two main conditions we are watching out for. Section 3, the two big concerns, preeclampsia and DVT. Condition number 1, preeclampsia. Preeclampsia. This is the word that obstetricians take very seriously, and for good reason. Preeclampsia is a pregnancy complication characterized by high blood pressure and signs of damage to other organ systems, most often the kidneys and liver. It typically develops after 20 weeks of pregnancy, though it can occur earlier or even after delivery. It affects about 5 to 8% of pregnancies worldwide, and it is one of the leading causes of maternal and fetal complications. Now, swelling alone does not equal preeclampsia, but certain types of swelling, combined with other symptoms, can be a sign. The swelling associated with preeclampsia is different. It tends to come on suddenly and severely. It often affects the face and hands, not just the feet. Your shoes and rings may suddenly feel impossible to get on. It may be accompanied by rapid weight gain, like 2 to 5 pounds in a single week. Other symptoms of preeclampsia to watch for: severe headaches that won't go away, Visual disturbances, blurred vision, seeing spots or flashing lights, pain in the upper right abdomen, just under your ribs, nausea or vomiting, especially in the second half of pregnancy, shortness of breath, decreased urine output. Here is what I need you to understand. Preeclampsia can escalate quickly. Left untreated, it can progress to eclampsia, which involves seizures, and can be life-threatening for both mother and baby. This is not meant to scare you. It's meant to empower you, because when caught early, preeclampsia is manageable. Your healthcare team will monitor your blood pressure, check your urine for protein, and make a plan to keep you and your baby safe. Who is at higher risk for preeclampsia? First-time pregnancies. Women carrying multiples, twins, triplets. Women with pre-existing high blood pressure or kidney disease. Women with diabetes. Women with a family history of preeclampsia. Women who had preeclampsia in a previous pregnancy. Age over 35. Obesity. If you have any of these risk factors, this is something to discuss proactively with your OB or midwife. Condition number 2, deep vein thrombosis, DVT. The second major concern with pregnancy swelling is a blood clot in the deep veins of the leg, known as deep vein thrombosis, or DVT. Pregnancy naturally increases your risk of blood clots. This is because your blood clots more easily during pregnancy, a protective mechanism for childbirth. Druhý, blood flow in your legs slows due to uterine pressure. Třetí, hormone changes affect your veins. DVT is more common in the left leg during pregnancy due to how the uterus presses on veins. How is DVT swelling different from normal pregnancy swelling? This is crucial, and the number one thing to remember. DVT typically causes swelling in one leg, not both. Normal pregnancy swelling tends to affect both legs fairly equally. If one leg is noticeably more swollen, harder, redder, or warmer than the other, that is a red flag. Other DVT symptoms. Pain or tenderness in the calf, often described as a cramping or aching feeling. Redness or skin discoloration over the swollen area. Warmth to the touch in that area. The affected leg may look slightly bluish. Why is DVT so dangerous? Because a blood clot in the leg can break off and travel to the lungs, causing a pulmonary embolism, a blockage in the lungs' blood supply. This is a medical emergency. If you have swelling in one leg with pain and redness, do not wait. Go to the emergency room or call emergency services. In Section 4, Other Causes of Abnormal Swelling. Preeclampsia and DVT are the two most serious concerns, but they're not the only ones. Let me briefly walk you through a few other conditions that can cause unusual swelling in pregnancy. Gestational hypertension. This is high blood pressure during pregnancy without the organ damage seen in preeclampsia. It still needs to be monitored, as it can progress to preeclampsia. HELLP syndrome. HELLP stands for hemolysis, elevated liver enzymes, low platelet count. It's a severe variant of preeclampsia and is a medical emergency. Symptoms include upper abdominal pain, nausea, vomiting, and malaise, often before blood pressure spikes. Kidney or liver problems. In rare cases, underlying kidney or liver issues can cause or worsen swelling. Your prenatal labs are designed to screen for these. Peripartum cardiomyopathy, a rare but serious condition where the heart weakens during late pregnancy or after delivery. Swelling combined with shortness of breath, fatigue, and difficulty lying flat should be evaluated promptly. Anaphylaxis or allergic reaction. Sudden, rapid swelling, especially of the face, lips, or throat, is a sign of a severe allergic reaction. This is a 911 emergency. Section 5. Week by week, what's normal when? Let's put swelling in context of your pregnancy timeline, because what's normal can depend on how far along you are. If first trimester, weeks 1 to 12, significant swelling this early is uncommon and worth mentioning to your provider. Some minor hand or face puffiness from hormonal changes can occur, but pronounced swelling before 20 weeks should always be evaluated. Second trimester, weeks 13 to 27. This is when most women start to notice swelling, particularly in the feet and ankles. It typically begins around 22 to 27 weeks. Mild to moderate swelling that improves with rest is expected. Third trimester, weeks 28 to 40. Swelling is at its peak. Almost everyone experiences it. Your feet may look unrecognizable by the end of the day. This is normal. However, sudden increases in swelling, especially combined with other symptoms, are always worth a call to your provider near your due date. Swelling often peaks in the last few weeks. Interestingly, some women experience a sudden increase in swelling right before labor begins, the body's final preparation. Section 6. When to call your doctor, the clear rules. I want to give you a really clear, simple framework here. Save this. Screenshot it, share it with your partner, call 911, or go to the ER immediately if you have. Swelling plus sudden severe headache. Swelling plus vision changes, blurring, spots, double vision. Swelling plus upper right abdominal pain. Swelling plus difficulty breathing. Swelling in one leg with pain, redness, or warmth. Sudden severe swelling of the face or throat. Is not a seizure. Call your OB/midwife, same day, if you have. Sudden onset of significant swelling, especially of the face or hands. Swelling that does not improve with rest and elevation. Swelling accompanied by a persistent headache, even mild. Rapid weight gain, more than 2 pounds in a week. Swelling before 20 weeks of pregnancy. Any swelling that feels different or unusual, trust your gut. Mention at your next appointment. Gradual increase in foot/ankle swelling, especially at the end of the day. Mild hand or finger puffiness. General discomfort from swelling. Remember, your healthcare provider would always rather get a call that turns out to be nothing than miss something important. Section 7. Home relief. What actually helps. Okay, now let's talk about the good stuff. What can you actually do about normal pregnancy swelling? Stay hydrated. This feels counterintuitive. Drink more water when you're already retaining fluid? But yes, dehydration actually causes your body to hold on to more fluid. Aim for 8 to 10 glasses of water per day. Drugi, compression socks. These are a game changer. Compression socks or stockings help push fluid back up from your legs. Put them on before you get out of bed in the morning, before gravity starts working against you. Look for pregnancy-safe graduated compression socks. 15 to 20 millimeters of mercury is usually recommended. 3. Elevate your feet. Whenever you're resting, prop your feet above the level of your heart if possible. Even just above hip level makes a difference. Do this for 20 to 30 minutes several times a day. 4. Keep moving. Staying still for long periods makes swelling worse. Gentle walking, prenatal yoga, and swimming are excellent for circulation. Even just doing ankle circles while sitting at your desk helps. 5. Watch your sodium intake. Excess salt causes your body to retain more fluid. This doesn't mean you need to go salt-free, but be mindful of highly processed foods, fast food, and salty snacks. 6. Sleep on your left side. Sleeping on your left side takes pressure off the inferior vena cava, improving blood flow back to your heart and reducing swelling. A pregnancy pillow can help you stay in this position. 7. Stay cool. Heat makes swelling worse. If you're in a hot climate, stay in air conditioning during peak heat hours. Wear loose clothing and avoid long periods in the sun. 8. Try water exercise. Being in a pool provides gentle, all-over compression that temporarily reduces swelling. Even just standing in water up to your waist can provide relief. 9. Gentle massage. Have your partner gently massage your feet and legs in an upward direction toward your heart to help move fluid along. Avoid deep or vigorous massage, especially if you have any concern about clots. 10. Wear comfortable, supportive footwear. This is not the time for heels. Choose shoes with good arch support, wide toe boxes, and no tight straps. Many women go up a full shoe size during pregnancy. Section 8. Quick reference symptom checklist. As promised, here is your screenshot-worthy symptom guide. Pregnancy, swelling, when to worry, checklist. Normal, manage at home. Gradual swelling in feet/ankles, worse at end of day? Rings feeling tight by evening. Mild morning facial puffiness. Swelling that improves with rest and elevation. Call your provider today. Sudden swelling of face or hands. Swelling not improving with rest. Weight gain of 2+ pounds in 1 week. Persistent headache with swelling. Swelling before 20 weeks. Go to ER/call 911. Severe headache plus swelling. Intestinal conseo, vision changes plus swelling. Upper abdominal pain plus swelling. Difficulty breathing. One leg swollen, painful, red or warm. Facial/throat swelling, possible allergic reaction. Okay, that was a lot of information. And if you made it this far, you are clearly a devoted, informed mama-to-be, and I am here for it. Here's what I want you to walk away with. Most swelling in pregnancy is normal. Your body is doing something incredible. But some swelling signals, something that needs attention. And now you know the difference. Trust your instincts. If something feels off, call your provider. You are never being dramatic. You are being a good advocate for yourself and your baby. If this video helped you, please give it a thumbs up and share it with a pregnant friend who needs to see it. Subscribe if you haven't already. We post new pregnancy health content every week. Drop your questions in the comments below. I read them all, and I may feature your question in a future video. Take care of yourselves, stay hydrated, put those feet up, and I'll see you in the next one.